Hey guys, my name is Faith and I will be discussing malaria for my presentation. So to begin with, I thought it'd be kind of funny to ask some people around me what came to mind when I mentioned malaria. And actually 100% of the people said either mosquitoes or they mentioned Africa. And in a broad sense, these actually do relate to malaria, so they're not false. And this will be shown later on in the presentation. So a little bit of history of malaria. Malaria holds a really unique place in history. As seen in these other disease presentations, a lot of the diseases have a specific date that they were discovered or when people first started showing signs of them, but malaria has its present states all the way back to the Neolithic dwellers shown in this picture here, early Greece and Chinese, and even princes and paupers. So there's not really a specific date for when malaria was discovered. It just seems like it's always been there. Recently, actually, some Egyptian remains detected a malaria agent that dated all the way back to the 3200, between 3200 and 1304 BC. There are many ancient writings and artifacts that are found, and even though they don't say malaria, they mention a type of deadly fever, which is actually one of the symptoms of malaria. So this kind of scientists kind of point this to the disease of malaria. Something I thought was kind of funny here at UD that related to UD, malaria is mentioned in Homer's Iliad, and also Aristotle and Plato are seen mentioning malaria. And then one of the turning points was in the first century AD when malaria, that's when malaria arrives in Rome. And then it still affects humans to this day. In the 20th century, malaria was the cause of between 150 to 300 million deaths. And that seems, a pretty big number. To put it in comparison, it's between 2 and 5% of all deaths for that year. And although malaria hasn't been common in all countries, 40% of people still live in places that malaria is common in, and it can be potentially transmitted to them. Transmission. So malaria is actually transmitted, like I said earlier, by a mosquito. This mosquito is of the Anopheles genus. It is a female mosquito. The populations that are most at risk here, you can see, are the tropical and subtropical areas. One big reason of this is because this is where these mosquitoes not only survive but multiply. A big component in that is the temperature that these countries are often in. And in the mosquito, this is where the parasite actually finishes their replication cycle. In 2015, malaria was the cause of around 429,000 deaths, and there were 212 million cases, and they were mostly younger children in the sub-Saharan Africa region. So that's going to be about right there. And at the bottom of the screen, you can see the CDC mentioned 3 other ways of transmission in the U.S. of malaria. The first one is airport malaria. This is malaria that is seen being transmitted from an endemic country to a non-endemic country through airport, so like travelers and things. Congenital malaria, this is malaria passed on from a pregnant woman to its baby. This is either during or before birth. And then transfusion transmitted malaria, which is rare, but it is a potential complication that is severe in blood recipients. Let's see. So what is malaria? Malaria is actually considered one of the most prevalent human infections worldwide. It's also called the Plasmodium infection. And this is a pretty fitting name because it is actually, malaria is caused by a parasite of the genus Plasmodium. So this picture is a picture of a boy named Mohammed, and by just looking at the picture, one wouldn't think, I wouldn't really think that he had malaria, one of the most prevalent infections in the world. And one may also wonder why he isn't showing any physical signs of malaria, but he actually did have malaria, and the signs and symptoms will be talked about later. So something that stood out to me about malaria were how malaria has 5 main species of the Plasmodium genus. These 5 species are the ones that can be found in humans. The first one right here, in this first shape, is P. falciparum. This actually multiplies in the blood, and this can lead to severe case of malaria, which can then cause anemia. The infected parasites cause small blood vessels to clot, which can be harmful to the brain, which is then called cerebral malaria. Cerebral malaria. And this can result in death. This is actually the most common one and most severe one found in humans. And in the picture is a picture of a thin blood smear of this species of malaria right here. In the second picture, the second one mentioned is P. vivax. This one is special because it has dormant liver stages. In a couple slides, I'll talk about how the malaria parasite infects the liver in the liver cells. Several months, so the dormant liver stage, so several months after, or even years after this mosquito bite, this parasite can actually reactivate and invade the blood. So the third type is P. ovale. It is very similar to P. vivax, but different in the fact that, so for P. vivax to invade, it has to have a specific receptor, which is called the Duffy antigen. And if red blood cells lack this receptor, then they are resistant to invasion by P. vivax, but it can be invaded by P. ovale. So people that actually have sickle cell anemia lack this receptor and are often thought of being immune to P. vivax attacking them. This fourth one is P. malariae, and it is the only parasite species that has a 3-day life cycle, unlike the usual 2-day life cycle. If left untreated, this type can cause chronic infections that have the potential of lasting a person's whole life. And then this fifth type is the only species found in animals. It is called P. knowlesi. This type has a 24-hour replication cycle, so it can go from mild to severe, like really fast. And the little monkey at the top is because it's often found in a type of monkey, since it's the only species of malaria found in animals. But this can actually go on to cause zoonotic malaria in humans. So some characteristics of Plasmodium. It is an intracellular growing parasite. It first grows and multiplies in the liver cells and then goes on to affect the red blood cells. So here's a picture right here of a red blood cell infected by malaria. You can kind of see the infection there. And another big characteristic of Plasmodium is its life cycle. There's actually a sexual phase in mosquitoes and an asexual phase in humans. Here you can see this little malaria transmission cycle, how it goes from the Plasmodium and then the mosquito gets it. Mosquito infects a person. Their liver cells are infected. The red blood cells become infected. Then the next mosquito bite, and then a circle. So some symptoms of malaria. So uncomplicated malaria. In common cases of malaria, patients can be observed to have a combination of the following: fever, chills, sweats, headaches, nausea, and vomiting or body aches. So a common person without having malaria in mind, a lot of people often think and relate this to either like a cold, flu, or another infection. But in countries where malaria is common and prevalent, people are able to kind of self-diagnose themselves once some of these symptoms pop up. Some of the physical findings of malaria are elevated temperatures, perspiration, weakness, enlarged spleen, mild jaundice, enlargement of liver, or an increased respiratory rate. And then in severe malaria, like I mentioned earlier, the cerebral malaria, there's severe anemia, acute respiratory distress syndrome, low blood pressure, and acute kidney injury. So prevention and vaccination. Something that stood out to me, and the CDC mentions, is that there's actually no current vaccine available because of how complicated the life cycle is of the Plasmodium parasite. It's been really difficult for a vaccine to be developed. Pretty much they have to figure out what part of the life cycle stage that the parasite targets for the vaccine. So, and the vaccine needs to target either trying to see if the vaccine needs to target one stage or all of the stages. So it's been kind of difficult, but there are a few vaccine candidates in clinical development, and one of the ones that's gone furthest in clinical testing is called the RTS vaccine. Here, there's the atovacone proguanil. This is a preventative medicine. It's often recommended to people traveling to malaria. To countries where malaria is common. And this is actually a picture of my best friend from kindergarten. She goes to A&M, and she's actually going to Honduras this next week. And this is the medicine that she's taking. Here's a picture of it, and then this is the instructions on that. So I thought that was funny how that happened. And then one of the also a huge preventative thing that's helped a lot of people in a lot of places with malaria is the insecticide-treated bed nets. So this is the personal protection that helps reduce malaria. These are just nets that cover the bedding, and they help malaria stay out. So yeah, that's my presentation on malaria.